In this video, we will be looking at some of the CT features you can encounter while reviewing post-operative CT scans following a right lower lobectomy. You're best off appreciating and evaluating the sagittal images for this purpose. You have two CT scans in front of you, and on the right you have the preoperative scan, and on the left the post-operative scan. As you can see, there's a suture line here showing that it is in fact indeed a post-operative scan. And these two scans are at the same level on the right lung. At first, we're going to evaluate the hilar region, where you can see that the bronchos to the right lower lobe and the middle lobe traverse posterior to the pulmonary vessels, and the middle lobe pulmonary artery extends in front, and the middle lobe bronchus curves around and extends anteriorly. When the right lower lobe is removed, the bronchus no longer has that curve, and you can see that it in fact curves posteriorly in that manner. You can also see the distortion in the anatomy, and you might wonder what this structure is here. That's in fact the rotated inferior portion of the what was initially the part of the oblique fissure. So the middle lobe in fact has completely rotated around and occupied this space. The costophrenic angle can still be quite sharp despite the entire right lower lobe being removed. We're going to go through some of these scrolling stacks in this case, and in most people the horizontal fissure is incomplete, and you can appreciate this better where in the periphery you can see the horizontal fissure, and as you go centrally it disappears. And in the post-operative situation there is no horizontal fissure at all. In fact, when this lobe gets removed, whatever's that left of the horizontal fissure gets distorted considerably, and this fissure here, which used to be the demarcation between the middle lobe and the right lower lobe, can rotate and now occupies this position here. So the orientation of the bronchi can be extremely useful in assessing a post-operative situation, especially if the surgical history is not very clear.